So as far as, yes, you did say it. I know it's a big mouthful. Eye movement desensitization and reprocessing. It's a lot to swallow. So EMDR is easier to say. It's amazing how much material is out there. When I first got trained in it way back in 2008 2009, it may have, if I look, it could have even been earlier than that, but I think that's around the time. There was a lot of information, but the research has just gone through the roof since then. It started back in the 1990s with Dr. Francine Shapiro, and she was actually, I believe, she was a doctoral student at the time. And the process started with her thinking about a situation that was upsetting for her in her personal life, and she was just walking the landscape one day and thinking about something that upset her. And after she finished her walk and went back up to whether it was the lab or I don't know the specifics, she noticed she felt a heck of a lot better. And nothing changed with the incident that was causing her some distress except the fact that she did her walk. So being a scientist and being in her training, she thought, well, wait a minute, is this because I did some exercise? I know there's a lot of research out there about exercise and decreasing stress hormones and so forth, but no, it wasn't that. So she decided to really investigate and do some more research and see if she could replicate her findings. And what they came up with was, while she was doing her walk, she was obviously moving her eyes back and forth as she was just scanning the landscape. So she thought, why don't I see if there's some validity to moving the eyes back and forth? And that obviously gave birth to a whole slew of research. And there are a lot of theories out there. I mean, we're not absolutely certain because we don't know enough about the brain to say this is exactly why it works. But we do believe that it mimics REM sleep. So if you think about when you're in REM sleep, your eyes go back and forth when you're dreaming. And we know when people go for long periods of time without dreaming, they have negative symptoms, such as they can get sick, they can start to hallucinate. There's many things when we don't allow ourselves to sleep. So we looked at, well, what does that mean? Is this like REM?